Regarding the possible use of a low dose of ATG in the context of post-transplant cyclophosphamide transplantation, I think that, as we have seen in our San Raffaele experience, we can have less rate of chronic graft-versus-host disease, but there are some issues, for example, regarding some poor graft function cases that still need to be well addressed. So I think that we need more numbers, we need multi-center trials, and we need probably different cases to draw any exact conclusion regarding this possible addition. It is important to underline that we have used to add ATG in this context based on the CD3 positive content higher in the graft of our patient. But nowadays we know that we can have different and more specific biomarkers trying to predict the risk of graft-versus-host disease in our patient that we cannot have really in the clinical practice easily nowadays, but I hope that we can have for the future. For example, in our center, but also in other centers, we have other biomarkers that has been investigated. We have also performed an experience with interleukin-6 with the microbiome, and there is also other studies ongoing all over the world trying to identify the best biomarker, for example, the MAGIC consortium. So I think that really for the future, we need to better identify which patients are at higher risk for graft-versus-host disease in the context of allogeneic stem cell transplantation by the beginning, and then trying to make a sort of stratification and give immunosuppression according to the risk of graft-versus-host disease of each patient. So maybe an individualized and personalized approach can be better for the future to have good results.